Hello friends, I am Dr. Kunal Das. I am head of the department and director, gastroenterology department in Yashoda Superspeciality Hospital, Kaushambi, Ghaziabad. Very important question. Probiotics, what are probiotics? Probiotics are live organisms or good bacteria which are good for our gut health. So probiotics are very useful and important. They have improved role. For example, in antibiotic associated diarrhea, probiotics are very useful. In acute gastroenteritis, you have taken something outside and you have bad bacteria coming into your system and causing loose motions, you can take probiotics. Again, it has been useful in many disease conditions like atopic dermatitis, about IBD like Crohn's disease and ulcerative colitis. Probiotics has been very useful. For other, even for weight management and obesity, there have been certain studies which have found that the probiotics have been useful. Probiotics have also been found to be useful for certain diseases like hyperlipidemia also. So probiotics are overall very useful in disease conditions. The foods which help in improving the gut health, first is some fermented foods. Fermented foods like if you take yogurt, if you get idli, dahi, these are fermented foods which are very useful because they contain a lot of probiotics in them which are good for health. Many of the hydration foods like cucumbers and watermelons, they give a lot of fiber to the body, they give a lot of water to the body, as well as many vitamins and minerals are given to the body. Third thing which are very good are the fiber containing foods, the vegetables. These are raw fruits and vegetables also provide good rich fiber to the body. Fiber is that part which is undigested and helps us in the constipation and passing of our stool. So they give the stool bulk to our patient and they help in passing the stools normal. As we know, if we pass stools normal, half our day is good, and many of these also contains lot of vitamins, minerals and many which are useful for the body. So gut health is of primary importance, and it is important to see the various gastroenterological commons. The common things which are there, like you have acidity and bloating, you may not pass stools, okay, you may have hard stools, or you may have loose motions, and also certain things like you have blood vomiting, or you may have blood in stools. These are the various disease conditions which are generally patient ignore, but they should not be ignored, because as we know, a stitch in time saves 9. If you today ignore your symptoms, the disease process may go high. Many times we ignore disease like jaundice or weight loss. These are also at the first instance we should go to the doctor and let the doctor explain that which are the diseases. The doctor is the right person who can tell you if the disease is can be solved in a small manner, or the disease needs a more appropriate investigations and diagnostic for proper treatment of the patient. For example, the symptoms that I said, for example, you have some acidity. So you should not ignore. Many times patient take only, but sometimes maybe a harbinger of a serious disease. For example, ulcers. It is, we do endoscopies to find out the abdominal cause of abdominal pain. So we do endoscopy, which is a flexible tube which goes to the esophagus and stomach and intestine. So we can see that if there is any ulcer, it can be easily found out by endoscopy. Also gastritis and duodenitis can be easily found out. So they should go to the doctor whenever you have blood in the vomiting or severe abdominal pain, or you have passed blood in stools also. Blood in stools can be a very important disease for hemorrhoids or any polyps or even colon cancer if it is associated with ulcer. For example, here is a prop-up of a colon which can see the various diseases which are there. Here there is a polyp, there is a cancer which is there, and it is very easy to find out. We can do simple test known as colonoscopy, which is a flexible tube which has a camera and a light attached to the end, and after cleaning of the colon, it goes from here and sees the whole colon of the patient, and it can find out what disease it has. If there is any disease, we can take a small biopsy which is 2 or 3 mm, and it can be examined under a microscope, and we can know the disease. As we know the disease, we can give a proper treatment and management for resolution of that disease. So this is another point which is there. And also I would like to say that if you have weight loss, it is a very important thing that one should consider, that one should not ignore it, because it may think that you may have some kind of a GI cancers. So I would suggest all my friends that whenever you have a blood vomiting or passing blood in stools, or you have weight loss, or you have bloating even, or jaundice, you should visit a doctor. He is the right person who can guide you to the various tests so that the disease process can be identified at the earliest moment. Thank you very much.